We have this false understanding sometimes that we're having to choose between, are we trying to control COVID spread, or are we opening up the economy? And I think we have some really smart people and some great individuals within our own community that can identify, how do we do both?
On May 1st, the Utah governor's coronavirus task force changed the color-coded COVID-19 risk level from red to orange, or high to moderate. However, since that time, more tests are showing increases in the number of those testing positive. Dixie Regional Medical Center's testing rate went from 2.9% to 4.9%, and now has doubled from the original testing just in the last few days.
And in the last 3 days, we've seen that increase to 6%. So it's something that I think we need to be cautious about. It's something we need to be aware of, and something we need to watch closely. But the trend is moving in a direction that I think is reasonable to perk our ears up as we're looking at those numbers.
While those new cases may not all end up in the hospital, Dr. Carroll said it's still important to follow the guidelines with social distancing, wearing of masks, avoiding travel, and washing of hands.
And do you agree that we need to continue to wear the masks, which we weren't doing in the first part of this pandemic? And when you go in the stores, some people are wearing them, some people are not. What's your recommendations there? And then there's also talk about those masks possibly reinfecting yourself or causing your immunity to go down. What's your take on that?
Yeah, I have great questions. I've not seen any data on wearing a mask causing immunity to go down. I certainly support what the state guidelines list, which are wearing masks when social distancing is difficult. So we can control where we go. We can't always control where people go around us.
Drive-up testing continues throughout Washington County, most with appointments, and hospital officials continue to be prepared. Dr. Carroll said that doesn't mean that every patient that comes to the hospital for treatment will receive a COVID test. However, those who are preparing for surgeries will need to be tested.
Additionally, all patients that are having elective surgeries are required to have COVID testing done 3 days before their surgery, and then social distance and isolate from the time they get tested until the time they have their surgery, so that we can, again, keep them safe, keep our caregivers safe.
Despite never being used, the blue med tents outside of Dixie Regional Medical Center in St. George are not coming down.
We have been prepared to use them. Based on some of the models, we anticipated opening up at least one of those tents this week, and we've not needed to do that. We hope we never need to do that. We don't have any plans to take them down in the near future. We want to make sure that we feel confident that we're not moving into a surge situation where we'll need them before we take them down.
While there are no national protocols or procedures used to determine how hospitals test or place patients, Dr. Carroll said Intermountain's philosophy is to make the right determination early on using rapid testing.
As patients that are coming into the hospital that are being admitted, we're running those rapid tests, and we're getting those results back within about 2 hours so that we can appropriately place them in the right floor. Since we implemented that a few weeks ago, what we've seen is the number of patients under investigation, or PUIs, in the hospital has virtually gone to zero.
While many would like to see our state go from orange to yellow soon, the increase in cases in many areas is prohibiting that move. Anyone showing signs should immediately get tested and quarantine or isolate if necessary. Until then, people are asked to adhere to gatherings of 20 or less, social distance, and wear a face mask when inside public areas. Outdoor recreation is encouraged to stay healthy within suggested guideline limits. From Washington County, Melissa Anderson, Community Education News.